Welcome to Let's Eat. I'm your host, Emily, holistic health coach and self-proclaimed wellness enthusiast, here to meet you at the intersection of physical and mental health, the exact location where optimal wellness lies. This podcast is meant to explore all areas of mind and body wellness, designed to offer you the integrative knowledge, behavioral strategies, and mindset shifts necessary to uplevel your health and feel better today. We'll explore nutrition, sleep, movement, self-care and stress management, habits and routines, gut health, mental health, and more. I am so happy that you're here. Welcome to the table. Let's eat. Hello, everyone, and welcome back to Let's Eat. Today, I am welcoming Dr. Kelly to the podcast. She is a chiropractor that's located in Clinton, New Jersey. And she's now been practicing chiropractic for 10 years, and she specializes in helping pregnant moms, infants, and children. I reached out to Dr. Kelly a few weeks back to add her to my professional network. I'm always interested in finding other like-minded individuals to connect with, but then also to potentially refer clients to. And when I learned that she specializes in this area of health, specifically with pregnant and postpartum women, infants and children, I was really excited to learn more. And so I wanted to invite her onto the podcast in order to do that. What I really love about this conversation is Dr. Kelly really expanded my view of chiropractic. And I can imagine if you're not super familiar with it, you might feel the same way after listening, just because I learned how valuable chiropractic can be, not just when it comes to what I think we typically think of as an issue that you might go see a chiropractor for, right? There's so much more beyond that, and she dives into seeing women who have menstrual issues, menopausal issues, and other issues that I think we might otherwise not connect with being relevant to chiropractic care. So I'm super excited for you to tune into this episode. All of Dr. Kelly's information is in the show notes. But thank you for tuning in to another episode of Let's Eat, and please help me warmly welcome Dr. Kelly to the table, and let's eat. Hi, Dr. Kelly. Thank you so much for being here today. Welcome to Let's Eat.
Thank you. Thank you for having me.
Sure. So I want to dive into learning a little bit more about your journey to where you are now, to the field that you're in. Please feel free to share, what brought you here.
Yes. I've been a chiropractor for a decade now, and I grew up in a chiropractic family. So my father is a chiropractor, my mother heavily interested in nutrition. So we really were raised to eat well, think well, move well. I would work in the office as a kid, even on snow days. I would be the one, doing the phone or the scheduling. And then eventually, when it came time for me to decide what to do in college, I knew I wanted to help people, but I wasn't sure in which way. So
Sure.
I knew the importance of physical health along with mental health and all, nutrition. So I had thoughts of should I become a counselor and, had classes in that in college. And then also I was leaning towards physical therapy. And then ultimately, my senior year of college, I decided in my dad's office, that's where I really saw big changes for people just when I
Sure.
was working there, as over the years. And I decided that's what I wanted to do as well as a way to help others to feel better.
Oh, I love that. That's such
Yes.
an inspiring story, to
Thank
be able to
you.
say, like, I grew up watching my dad do this, I was a part of it, and now I'm doing it on my own.
Yes. And
Yeah.
then at my senior year of college, I was looking at schools, and there's a few, options for chiropractic school. So I first went to Life University, that's in Marietta, Georgia, and
Okay.
then transferred to Palmer College in Davenport, Iowa. And it was a great experience at both, got to meet a lot of people from all over the country and the world that are also, you know, health health conscious and like-minded. So it was really a great experience. And then upon graduation, I was an associate in one of the largest practices in the Northeast in
Okay.
upstate New York. So that was also a great learning experience. Saw thousands of people, literally thousands of people a week. It was very
Wow.
high volume. And then after that was an associate in Morristown, New Jersey, for a female chiropractor that I really look up to. And then ultimately opened my own practice in 2017. So I've been there since, and it's been, a great journey, and I really enjoy helping people there.
Yeah, yeah, so cool. So it sounds like you've dipped your toes in a number of different areas in terms
Yeah.
of your experience. So
Hmm.
I'm curious if you could share a little bit about this question just came to mind, and
Yeah.
I'm just so curious. The roots of chiropractic, like I'm
Yes.
all about holistic wellness and, a lot of what we see and what we use now dates back to Ayurveda and Chinese medicine. So I'm wondering if you could share a little bit on the origins or just, the background of chiropractic work.
Yes. So it actually began in 1895 by Dr. D.D. Palmer. And he's a Canadian, and he was interested in, spiritual aspect of things. He was into magnetic healing, which was a little popular back then. And him and his family, they moved to Iowa, so Davenport, right on the Mississippi. And while he was there, a janitor in his building had a heavy object fall on his head, and his name was Harvey Lillard. And so D.D. Palmer, with what he knew about the body and just healing at that point, he had a thought to look at the man's neck, and he put pressure on that man's neck. There's controversy of exactly where in the spine it was, but he did apply pressure on the spine,
Okay.
and that man's hearing was restored because when that heavy object fell on his head, he lost hearing. He,
Okay.
had issues. So D.D. Palmer, he gave that first adjustment, and then chiropractic was born. And
Hmm.
then his son, B.J. Palmer, and I used to give tours of the Palmer, mansion and the
Oh,
campus. So
cool.
I know a
Okay.
little bit about the history. I found it really interesting.
Yeah.
But B.J. Palmer, he was his son, and he was the one that really got the word out about chiropractic. So he was involved with a radio station that was across the street from the campus. And Ronald Reagan worked there actually years ago. That was one of
Cool.
Ronald Reagan's first jobs.
Okay.
Yeah, so he got the word out about chiropractic, and then the family has carried it on, and that's still one of the biggest schools. And they have campuses in Iowa, Florida, and then California.
Okay.
So chiropractic itself, it's a holistic look at the body. So
Sure.
overall, the focus is on the nervous system, so the brain, spinal cord, and all of the nerves. And the thought is that, and the approach for chiropractic is that if any of those spinal bones are out of alignment, they can put pressure on the nerves, impact how those nerves are functioning, and then those areas of the body won't do their job as well. So
Okay.
that is the background of chiropractic. And if you have any specific questions about it, I may even have to look up, the
Yeah.
history more,
Yeah,
but
yeah, yeah.
that's what I learned in school at Palmer.
Okay.
And yeah, what I love about it though is that it is a whole body approach.
Sure.
So I find sometimes people will come in and, there's so much focus on the shoulder or just like the knee or the ankle. And in chiropractic, we think of terms of, okay, what else is happening with the knees, ankles, hips, the rest of the spine? How's the tension in the neck and shoulders? So
Sure.
really every adjustment, visit, evaluation, it's thinking of the whole body, and
Yeah.
not only like physically, but I kind of look at, what's going on in their life, any like thoughts, traumas, toxins, stressors going on. So it's really like a big picture approach of a person's wellness. And,
Yeah.
just seeing that growing up, that it's, not only is someone getting adjusted, staying in alignment, and, making sure that everything in the spine is aligned, or how's your nutrition, how's your
Yeah.
sleep, are you working out? So it's really all of that together leads to the best health for someone.
Right, right. Yeah.
Mhm.
And I'm sure you come across that a lot. And, I'd be curious for you to speak on it. When someone comes in thinking that it is, in fact, just like a spinal issue or just, oh, it's just tension here. It's just, fill in the blank. And then all these components that you also rattled off having to do with our lifestyle, nutrition, toxins, sleep, and so forth. How illuminating that can be for someone when they maybe
Yeah.
just don't have that awareness because of our healthcare and the way that we operate is not how nutrition and all of these factors kind of come together to create disease or
Right.
dysfunction. I'm sure there's a lot of educating that comes from your end of things to let them know, okay, let's talk about these factors and how those can place influence as well.
Yes. So it definitely, I believe education is part of the healing process. So my first two visits with anyone are, longer time period. So it's about 45 minutes that first day to not only examine what's going on with them, so a full health history, nerve assessment, and muscle assessment, but also I do about a 5 to 10 minute, speech or lecture for education about what the approach is. And I go over the different levels of the spine and then how, let's say, pressure in the neck can impact the ears, eyes, nose, or throat, leading to headaches, migraines, vision problems, hearing problems. I'll go over how in the middle back more so can impact our stomach, heart, and lungs, any issues there. And then in the low back, so from our small intestines, large intestines, reproductive organs, bowel and bladder function. And I'll also kind of cater that to what they have going on specifically, because I'll not only see people with spinal issues, like as far as, their neck or middle back or low back, but also joint problems. So shoulders, elbows, wrists, knees, and ankles. So a lot of chiropractic schools, we have training in adjusting extremities. And I'm
Okay.
thankful at Palmer, we had extensive training in that. So a lot of times people come in with just back pain and they don't realize that also this can address their headaches, different,
Yeah.
orthopedic or shoulder, elbow, wrist issues they're having. And that has been neat to see people have that light bulb click, like,
Yeah.
oh,
Yeah.
this not only is like for one area of my body, but for, anything that the nerves could be related to,
Sure.
which really our nerves are directly or indirectly for all the communication in the body. So
Sure.
from the brain to, every area, our fingertips down to our toes, and also from the body back to the brain again. So it's really, I enjoy educating people about it. And
Yeah.
I'm always kind of, it's in this day and age, it makes me a bit sad that in a lot of cases, our education as far as the body ends after high school a lot of
Yeah.
times. And, unless somebody's studying a specific topic in college or interested in reading books on their own,
Sure.
or I find a lot of times people are unaware of their anatomy or like
Yeah.
what um is going on with themselves and kind of tune it out. Like they'll
Yeah.
also kind of zone out what pain they're having and push through because they might not have time or
Sure.
money to address it then. But so I like to really talk about the anatomy and then what's going on with their body and show pictures for that and
Okay.
images. So that way there's an understanding of, how chiropractic is working for them and then
Yeah.
how we'll help them reach their health goals.
Yeah. Yeah, and I appreciate that because I think that that sounds very foundational, but I
Yeah,
can imagine there's probably and I can't speak and generalize and I don't want to generalize, but I'm sure that there's a lot of chiropractors out there that maybe aren't as thorough as what type of education that you're offering them. And I think
right.
it's almost essential to understand how, all of this is connected and giving them that kind of giving them that picture first and foremost, so then they can say, "Okay, how is this relevant to me? How is this
Right.
manifesting for me? And how is this going to make a difference in the healing process?" And, I think that that's so important to have that understanding first and foremost.
It is. Because then sometimes if they're not understanding or kind of picturing it, then they're like, okay, how's this working? Is this going to work? And it really, I'm thankful I did learn a lot of this education piece in school, but also in a practice upstate New York that,
Right.
taught me how to get that message across and
Sure.
communicate. And it's really been a helpful skill practicing these 10 years.
Yeah, yeah, that's so great. Well, I appreciate that explanation and
Yeah.
that, you know, breakdown of the whole body and the connectedness of it all. So you specialize in women who are pregnant as well as infants and children. So I'm very, very curious to learn more about your work in that specific population.
Yes. So I'll talk about for pregnant moms first. A lot of times with pregnancy, there's a lot of changes with the body. And myself, I've gone through it 2 times now. So I kind of speak from, more recent experience from my 4 and 2-year-old. But with pregnancy, your body changes, things kind of shift and expand, and there's a specific approach called the Webster technique. So that's what I do for pregnant moms. And it's
Okay.
basically a way to look at how their tailbone is aligned along with the round ligaments, which are on our front side of the belly. So from like the hips and up. And by making sure there's no tension in the tailbone or hips, and then also for the ligaments, just make sure everything's expanding evenly and at the same time for that area. So it really helps relieve low back pain and then sciatica. Even in cases with breech babies, like if their head is right side up instead of going down, then I've helped, quote unquote, flip breech babies with the
Okay.
Webster technique. And also, not only during pregnancy, but I've helped and seen a lot of women postpartum if they're,
Okay.
having shoulder tension from breastfeeding and holding their baby. Postpartum also can involve a lot of emotional and hormonal changes. So if,
Yeah.
kind of, and that's, an area that I think in healthcare in general, and I see it in our county, there's now a group that is bringing more awareness to help women in that phase.
Yeah.
Because there's difficulties if they're, having any depression, anxiety, or mental health struggles.
Sure.
So those are, and I'm not an expert in those by any means, but I can, refer them to the right person or just keep
Sure.
an eye on how they are,
Yeah.
and also talk about breastfeeding. But really, I enjoy, helping women in that phase and talking to them, and also usually send out a lot of information alongside with the adjustments as far as what they may be expecting for birth and baby care, and
Mm-hmm.
what gear is necessary. So that really has become my passion the last 5 years. And also for infants, so a lot of times families will bring their kids in if they are having, colic or issues digesting, sleeping issues, or not, or if they're crying a lot. Also torticollis or neck tension. So recently a baby came in last month, and the parents were just exhausted. They're like, this is a 2.5 month old, and the baby's crying constantly and they're in pain, and the poor mom, and dad, they were up at night waking with the baby.
Sure.
Um, I could just see they were exhausted, and it's in that baby's case. So I adjusted him. We saw some changes because he had a lot of pressure in his neck, but at
Okay.
that age, they can't, verbally tell you.
Of
So he just
course.
crying and acting out
Yeah.
and in pain, but can't communicate it. So by adjusting his upper neck and then tension in his shoulders, a little bit in the low back, then he had some improvements even that week. But
Okay.
then week to week, he's been coming back once a week. And now that he's sleeping better, the mom looks rested. She's so
Oh, yeah.
happy. She's like, thank
Okay.
you that, they got their baby. And he could see that on the baby's face. He's just smiling and,
Yeah.
feeling good. So that's why I really like to help out infants and, families going through that, because it's
Yeah.
not a fun journey to, to be in the middle of.
Yeah.
Um, and then for children, so as kids get older, some of the things that I'll see in the office would be, asthma, allergies, bedwetting, behavioral issues, whether it's ADD, ADHD on the autism spectrum. So I've seen a lot of changes that kids, especially if they're hyperactive, but by
Okay.
getting adjusted, helps out their nerves, their brain and body communication, and they'll kind of mellow out and,
Okay.
you know, be able to handle stimuli a bit better. So I see that often in the office lately. And yeah, so that I do see a lot of women, pregnant moms, infants, and kids. And then
Okay.
also women that are having menstrual issues. So
Yeah.
if they, let's say, are having some will have a period constantly, like it won't go away, or
Yeah.
it'll
Yeah.
be
Yeah.
4 weeks in a row and a little break and then come back. So irregular periods, or any like mood issues. So I'll help out as far as adjusting their nerves, especially the nerves to the low back, which go to the uterus and ovaries. And
Okay.
then I find that when adjusting them can help, for a regular period again, or less cramps. And that has been great to see in the office as well.
Yeah.
And then as far as menopause, so women that they'll have extreme hot flashes or issues falling asleep or staying asleep. So there's adjustments that I'll do, especially, in the neck and even through like the cranium or head that will help decrease the hot flashes and then help out in their sleep. So that's been
Okay.
great to see in practice.
Yeah, this is so cool. I just
Yeah,
wouldn't have even thought or made a connection between
right.
something like this
Mhm.
and the issues that you were listing. So when it comes to children and infants, are pediatricians recommending chiropractic, or how does that work exactly in terms of, is it something that, you're seeing doctors more commonly recommend? Is it more like of a holistic approach to things? I'm just
Yeah,
curious to know more.
that's a good question. So for chiropractic, we don't need a medical referral. A lot of times families will call right in and schedule, and they might know of me, through someone else that came into the office or just from, word of mouth in the area.
Sure.
And, it's an interesting question because back, you know, I'd say 50 years ago, chiropractors and medical doctors didn't really like each other, I would say.
Okay.
And there's history with that. There were even court cases in the 70s
Oh,
where
wow.
the
Okay.
medical field almost tried to get rid of chiropractic. But obviously that didn't happen. And today it's the largest natural drugless healing profession in the world.
Oh, I love
And
that. Very
it
cool.
is. And nowadays I will see more often support from a medical doctor that, let's say someone goes to their doctor and talks about, especially, joint issues or any, aches, pains, or muscular problems. In the past, like 10 years ago, I would hear more often, oh, they said, don't see a chiropractor, or don't do this. But now there is more support and they'll say, keep getting adjusted. I
Okay.
think they're seeing more of the benefits of it and that it's
Sure.
helpful than harmful.
Okay.
And a lot of graduates now, or at least what I've seen with my school and circle of friends, is we or in my office, I do use a gentle approach. So it's very
Okay.
specific and gentle using the activator method. And with that, overall, people are, because sometimes they would be a little hesitant if it would be too aggressive an adjustment, like any
Yeah.
twisting or cracking or popping. And those, type of adjustments and approach work as also, but
Sure.
sometimes they might adjust more than one level. So it's in my opinion, can take a little bit longer to see changes.
Okay.
But with the activator method, what I really love about it is that it is very specific, very gentle, and effective.
Okay.
And that's been, I think, why a lot of people are gravitating towards the office, that I've seen that might have been hesitant to go elsewhere if they're kind of afraid of chiropractic or if it might hurt them.
Yeah. Yeah.
So it's a really gentle approach. And I think that's helpful for a lot of people that might be on the fence about it.
Yeah. Okay. I think I might be one of, one of those
Yes,
people.
a
I
lot
can't
harder.
lie.
And I don't blame that, because, and I grew up with it. So I thought,
Yeah, of
I just
course.
trusted it. And it was like the turning of the neck. And I personally, I don't do the neck rotation. I use the instrument instead and then
Okay.
gentle stretches along with it. Um, but that, yeah, it's everybody's personal preference, I would say.
Yeah.
And but I will tell you, at least 80% of the time, people are very relieved to hear about the approach. They're like,
Yeah.
okay,
Yeah. Yeah.
they'll let their guard down, they'll be relaxed, and it's a very relaxing, comfortable experience. And
Okay.
I don't mean to talk bad about other chiropractors or
Yeah.
approach.
Sure.
They're fantastic, love them. They're, how I got into the field, and I've been adjusted by many and love how they operate. But there are some people that are a little more cautious, and
Yeah.
then they do gravitate towards a more gentle approach, which more
Okay.
graduates now are starting to do.
Sure. Yeah. Okay. Yeah.
Mhm.
I appreciate that explanation.
Yes.
That
Yeah.
definitely have. So I saw my dad growing up. He
Yeah.
religiously would get
When.
adjusted. Like that's where I
Mhm.
learned about chiropractic work and
Oh,
so
wow.
forth. And so yeah, it's interesting that you're saying that there's maybe varying approaches to it, especially when you're working with an infant. I can't even
Yeah.
imagine what type of care you have to take with such a small body and just such
Yeah.
a small being.
It's very gentle and it's about the, if you're checking the ripeness of a, avocado or tomato, it's a very light pressure on
Okay.
that area. So it's a sustained pressure or hold at their little spinal segments. And you could literally see the relief on their face, especially that baby I mentioned, recently, like, because he was in such distress and I
Sure.
see
Yeah.
them and the crying. And then now he comes in smiling, happy, and it's great to see that before and after. And a lot of times I'll feel a lot of muscle tension, for infants or
Yeah.
kids and adults. And I'll also, and I'm not doing massage by any means, but I'll do gentle stretches along with the
Yeah.
adjustments just to see that everything in that area is relaxed and, not only feeling better, but functioning better. So are those
Okay.
nerves, sending the signals at that level of the body that it needs to?
Yeah. Okay. Interesting. So I'm
Yeah,
curious, just thinking about, when you have individuals coming to you for specific concerns, do you find that you're seeing people on an ongoing basis, or do you find that it's more of I have a specific concern, let's address it, and then, you know, we move along? I ask this because I'm wondering if we're looking at it through maybe a symptom based versus a root cause or root
right.
problem issue.
Yeah,
You would hope that maybe through a certain amount of sessions or coupling chiropractic work with nutrition adjustments or whatever the case may be would eradicate that issue, and that would get at the root versus somebody who's seeing you maybe once a month or whatever with whatever frequency, and that problem's not actually going away. So what do you typically see?
yes, that's a great question. So a lot of times there's two aspects to care. So there's the acute phase or, corrective care that's in the beginning.
Okay.
And that is different for everybody. But a lot of times with my approach, I'll adjust them once or twice a week for a
Okay.
certain number of weeks. So usually it's like 8 to 16 weeks, depending how severe something is.
Okay.
And then after that, they graduate to maintenance care. And maintenance care in my practice, it could vary. Sometimes it's once a week, sometimes every 2 weeks, or in other cases every 3 weeks, just to
Okay.
check in and maintain. And I personally myself, I get adjusted every 3 weeks, and I plan
Okay.
to for life because I've seen since birth, and then through every phase, it just helps me feel better and function
Okay.
better.
Yeah.
When I was younger, it helped me. I was involved in competitive dance, cheer, and gymnastics. So it helped, like even college, the D1 level. So it
Oh
helped
yeah.
me with, any injuries with my wrists,
Sure.
ankles, and anything. So it helped me perform and just to feel good to do all of that.
Sure.
And then same in this season of life, as a wife and mom and, operating this office solo, I have to feel good to,
Yeah. To do it
do each
all.
day, it's
Mhm.
and I know, and with that's a whole other topic, but with toddlers you can get some, colds if they're in around other kids.
Yeah.
So
Yeah.
I make sure I get adjusted because getting
Okay.
adjusted, it actually helps improve the immune function. So NYU did a study that showed that those under chiropractic care have 200% increased immune function. So
Wow, very cool.
make sure that I get adjusted, to prevent anything, and then also just to feel well and function well.
Okay,
Mhm.
very cool. Yeah, I love that. So
Yeah.
you answered my question there. I think that it can be an ongoing
Yeah.
um,
And I recommend that. And I see
yeah,
that in practice because once people are feeling better and they, even things like going to the bathroom better, sleeping better, they're more
sure.
active in their workouts, they want to maintain that. So I
Yeah,
almost look at it as, almost like dentistry or, you wouldn't just ignore the dentist for 5, 10 years
sure,
and
yeah.
hope for the best, but it's spinal hygiene, making
Yeah,
sure your spine is in alignment, then everything can function well and there's no pressure on the nerves. Because I don't know if I got into the actual concept earlier, but we have all of our spinal bones in our back. And if any of them are rotated, that could press on the nerves, and then that nerve won't do its job. So, with gentle corrections, that alignment can be restored and take the pressure off the nerve. And
okay.
that's when health and healing can be achieved better.
Yeah,
So, that overall is the approach. And then people, they want to come in, they'll come
yeah,
in, every 2 to 3 weeks or
cool.
even weekly, it just depends.
Yeah, very cool. I'm sure you get to know your
Yes.
clients on
Yeah,
a more personal level with that,
I
because you're seeing
do.
them regularly. Yeah.
Yes. Yeah, it's really great. I feel blessed to be one and glad my journey has brought me on this path.
Yeah, very cool. So I love the name of your practice. I think
Yes,
Abundant Health is such a beautiful name. I'm wondering
thank
what
you.
inspired you to choose this name.
Yes. So actually, when I was a chiropractic student, the name of it just kept coming to my head out of nowhere.
Okay.
And this might show my age a little, but I think for phone books, like you wanted to be an A,
Yeah, yeah.
like show up first. And not
Yeah,
that phone
yeah,
books
yeah.
were even used around that time, but I always thought like A, abundant health. And then I didn't plan on opening my own, but just the way life happened. And when I got married, my husband supported me to open, my small practice that is right in Clinton, New Jersey. And yeah, I just already knew that name in my head from when I was in school. There wasn't really a one, I don't know, moment, but I just kind of knew it. And
Yeah.
I get compliments on it. And it's been a nice, fit for the brand and the
Yeah.
business there. Hmm.
Yeah, I think that's great. I think it sounds like it was very aligned for you because it
Yeah.
kind of kept showing up, and
Yeah,
it speaks to what you're doing.
it
That's
does.
awesome. Yeah.
Thank you.
Well, Dr. Kelly, is there anything else that you feel would be valuable for the audience to know about your work, the world of chiropractic, anything that you want to share?
Yes. Just in general, that if anyone is skeptical or not sure if they should try it or not, just go check one out.
Yeah.
And with any field, it is best to see someone that others may see or that you may have had recommended, because then it's like a busy practice that has seen a lot of people, they have
Sure.
experience. But I say it's worth it no matter what health issue is going on. If your
Yeah.
nerves are working better, it'll help. And I'm not, giving any promises that it's a cure all or,
Sure. Sure.
a quick fix by any means, but I believe it's part of a healthy lifestyle. I've seen that in my life. And I'm so thankful, to be able to adjust my husband and
Yeah.
kids, and that, it really helps us stay on our A game and,
Yeah.
get healthy and stay healthy. So there's not a person that I wouldn't recommend it for. And if anyone has questions, feel free to reach out to me. And
Sure.
then if and then I believe you have my website. If you share the website, because
Yes.
my office, Abundant Health Chiropractic, it's in Clinton, New Jersey, and it's in an old historic building. It's from 1760. It was the Jones Tavern during the Revolutionary War, so a lot of
Oh,
history there.
cool. Yeah. Yeah.
And so it's a nice space there, and I do see people regularly in a quiet, calm environment, and it's all private, and it's a really nice experience. So I really love to take care of others there, and
Yeah.
then would be happy to answer any questions anyone has.
Okay, yeah, that's great. I'll put all of your information in the show notes so anyone
Perfect.
can access that there. It'll be your website and they can obviously get in touch with you in that avenue. But I appreciate you so much for coming
Yes.
on to the show to share.
Yes. Thank
It's been
you.
really great. Dr. Kelly is someone who's local to me, right in the area. We but both went to the same high school as well,
Yes.
which is pretty
Mhm.
cool. And it's been such a pleasure to kind of hear a little bit more about your work. It's been really great.
Thank you. Thank
Yeah.
you for having me, Emily. And if you need anything, let me know.
Yes. Well, thank you everyone for tuning in. Like mentioned, we'll put all of Dr. Kelly's information in the show notes so you can connect with her. But thank you for coming to the table today, and I hope to see you next time. Take care.